All right. Hello, everyone, and welcome to the stream today. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. So today we're going to be talking about vaccine safety. And before we do that, I wanted to cover some data that we've been seeing with respect to the pandemic and case activity and things most recently. As we're going through the content today, if you do have questions, feel free to pop those into the comment section below and we will try to answer those questions live. And as always, if you have questions after you're watching the recording of this video, you're more than welcome to submit those questions to us via direct message or email or on our Facebook page, and we'll try to get back to you on that. So without further ado, we're going to start talking about the COVID-19 case activity that we've been seeing most recently, and things are moving in the right direction. So that always makes me happy when I can report that our case activity is decreasing. It's still a little bit higher than where we want it to be, but I think the trends are showing that we're moving in the right direction. So in terms of our numbers that I'm presenting today, this is the daily snapshot that we try to post every weekday on our Facebook page. So this data is from the 21st, which was yesterday. Right now we are looking at 766 active cases in Rock County. So this number is still a little bit higher than where we were in the summer, but the number is continuing to show a steady decline over the last week or so here. So that's good news. At the beginning of last week, we were in the 900 range, and so I think it's positive to see that our active case numbers are declining, which is good, and we want to see those numbers continue to decline. We have a total of 19,546 Rock County residents who have tested positive. In terms of a daily increase, that's 34 new cases, and when we look at our averages over the last 7 days, we're averaging just about 30 new cases per day being reported to the health department. So this number is another number you can kind of track to see what our trends are in terms of what direction we're moving. And the good news is that that average number of new cases being reported to the health department is declining. So a couple of weeks ago, we were in kind of the 40s or 50s in terms of our case activity, and now we're in kind of the 30 range. So hopefully we continue to see those trends continue, and we will shortly be kind of in that CDC threshold for potentially moderate spread. If those trends continue, that would be great, and we would continue to see a decline in case activity. There have been 216 deaths due to COVID-19. This was an increase of 1 since the previous day. Normally, when we get reports of deaths due to COVID-19, these deaths have occurred over the course of the past couple of weeks and not necessarily in the past day. So when we do report an increase in our total number of deaths due to COVID-19, it's likely that there is some time between the person who has passed away and then their death being added to the official tally, just because we want to make sure that that death is indeed due to COVID, and we're waiting on reports from our medical examiner to make that call and that determination. And then we have almost 90,000 people who have completed the vaccine series in Rock County. So we're up over 50% of our Rock County population who have been fully vaccinated. It's about 53.5% of the total population, which is good news. And as always, we're waiting on additional information in terms of booster doses for people who are in higher risk segments of the population. And also we're waiting on news for updates on the 5 to 11-year-olds. So hopefully we'll be able to share information on that soon. We don't have any official information to share at this point, but I'm really hopeful that we'll see increases in eligibility, and we'll see even more people getting vaccinated in the county. And so that brings us to the topic for today, and that is related to vaccine safety in Rock County. So we've had some questions come in from our public, and people are very interested to know kind of what the data shows in terms of how many people have had adverse reactions to the vaccine, the COVID-19 vaccine, whether it's Johnson & Johnson, Moderna, or the Pfizer vaccine. And unfortunately, we don't have incredibly strong data sets right now to track all of the adverse reactions. Many people have experienced some symptoms after being vaccinated. That includes being fatigued, mild fever, some soreness in the arm, and sometimes that information isn't captured. So in my personal experience, when I received the doses of the Moderna vaccine, I definitely was very tired and fatigued and had a mild fever the following day. And that information isn't reported or it wasn't recorded in any kind of official sense. So, when we're talking about adverse reactions, the data that I'm very interested in is kind of those severe adverse reactions. And so the data set that we have available to us is related to the number of people who have presented to their healthcare provider reporting adverse symptoms or symptoms related to their COVID-19 vaccine. So these may be symptoms that are a little bit more severe. In some cases, people experience swelling or a higher grade fever. Some people have allergic reactions to the vaccines. And so we're trying to capture that information to get a sense of, how pervasive these kinds of symptoms are in Rock County, and also try to start to show the safety of the vaccine. I know that there are some concerns that people have expressed in terms of the safety of the vaccine, and I think the data shows that while there are people who have those allergic reactions and maybe have stronger reactions to the COVID-19 vaccine, compared to the total number of people who have received doses of the vaccine, it's still pretty rare to see some of these adverse reactions. So when we looked at the data over the course of the last kind of 11 months or so, there were 78 reported adverse events that were related to the COVID-19 vaccine. So these are instances where people showed up to their healthcare provider, to urgent care, the emergency room, and were reporting a reaction after the COVID-19 vaccine. And so this is 78 adverse reactions that are reported in this system out of the 181,000 plus doses of the COVID-19 vaccine that have been administered among Rock County residents. So it's a very, very small percentage of people who are receiving the vaccine who have strong reactions. And thankfully, although there are some people who have pretty strong reactions to the vaccine, there weren't any deaths that were reported in this data set due to the vaccine. So that is a little bit of a good news, despite some of the adverse reactions that people did have to the vaccine. So moving forward, what I'd like to do is put together a report that I can put on the website and have it updated on a regular basis so we can track over time and we can share information with community members and people in the public who are interested in this data. And you can track kind of in real time to see, okay, so how many people are experiencing adverse events related to the COVID-19 vaccine. We'll try to also provide some more information about the types of symptoms that people are experiencing and the dates for which these people are experiencing these symptoms. And we'll probably end up grouping this on a timeline similar to what I have on the next slide here. So these are the number of reports of adverse reactions based on the data set that we have access to. And this is the time frame. So in looking at the data, we want to try to give a sense of when the timing is occurring. And most of the people who had adverse reactions to the COVID-19 vaccine, unsurprisingly, occurred in the period kind of in the first 6 months of 2021. And this is also the time when there were the most doses of the vaccine being administered to individuals in our community. So you would kind of expect the more people who are getting vaccinated, the more potential there is for some of those individuals to have adverse reactions to the vaccine. So the other piece of information that I wanted to share, I'm going to switch gears a little bit here, is other vaccine safety information that we have put onto our COVID-19 website. And sorry, I'm getting ahead of myself, so I'm going to back up a little bit. So here we are at the Rock County Public Health Department website. And you can see, again, I know if people are viewing this and they viewed previous videos on our Friday Facebook stream, this is a little bit of repetition, but as you go to our website, the website is co.rock.wi.us/public health. You'll see the image here of the coronavirus. You'll click on that and it will bring you to the health department's coronavirus disease 2020 2019 page where we have all of our resources information. We have our popular links here at the top of the page, and I'm just going to scroll down and click on the data section. So as you're navigating through, you'll be looking for the data related to COVID-19. And I'm sure many of you have seen this before, but the new piece of information here is related to the safety of COVID-19 vaccines. So the first link will take you to a CDC website that explains the safety of the vaccine, showing some of the data in terms of how many doses have been administered across the US and how many people have had adverse reactions and things like that. They do have some information in terms of the very common side effects from the COVID-19 vaccine. And they also go into information about the serious problems. Although being rare, it's important that we're aware of these potential side effects of the vaccine. So anaphylaxis is a severe allergic reaction. I'm not even going to try to pronounce the thrombosa. I guess I'm going to try thrombosis or thrombocytopenia. I'm not sure if that's how you pronounce it, but this was the blood clotting issue that was associated with the Johnson & Johnson vaccine. And as you look at this information, you can get a sense of kind of how rare these side effects are and what are some of the risks. And you are more than welcome to take a look at this information as you're making your decision about whether or not to be vaccinated. The other piece of information that we're including in this section is our link to the VAERS, which is the Vaccine Adverse Event Reporting System. And this is a system used by the federal government to try to track any types of commonalities and adverse reactions that people are experiencing to the vaccine. And this is not limited to the COVID-19 vaccine, but since we're in kind of this era of fighting the pandemic, there are going to be lots of data points related to the COVID-19 vaccine. This VAERS data is self-reported, so they're asking people to kind of go into this system, and if they have adverse reactions, to report those adverse reactions. So I, as a patient, could go in if I had an adverse reaction that was very strong. I could go in and enter my information into the system so that they could keep track of those types of events. They also can have providers go into this system and enter in information on patients that they're aware of having adverse reactions to any type of vaccine, including the COVID-19 vaccine. And one of the kind of features of this website is that people in the public, anyone who's watching this video, myself, can go in and try to access the information and the data that's housed in this VAERS system. So one of the things is the interpretation of this information has become a little bit problematic because VAERS data is collected in a way where they're casting a wide net and they're trying to get as much information as possible across the US with respect to adverse reactions and events related to the vaccine. So there are situations where if a provider has given the vaccine, the COVID-19 vaccine, to an individual, and 6 months later, that person comes down with COVID-19 and they pass away, or they pass away from another type of illness or a situation, that provider could enter that information into the VAERS system with respect to that person's death. And the reason being is that we don't know all of the potential side effects, and we want to make sure, as like I said, we're casting a wide net to capture as much information as possible. And then what the CDC does with that information as it's entered into a VAERS is tries to capture additional information related to that death, looking at the death records, some of the patient's health records and things like that, to make a determination whether or not this death was related to the COVID-19 vaccine or another type of factor in that person's life. And so one of the nice things is that as a member of the public, we have access to this VAERS data. But one of the problems with it is that it kind of lacks that ability for interpretation. There's disclaimers right on the VAERS system that says, this data should not be interpreted as causation. So these are, again, trying to cast a wide net and capture as much information as possible about any type of possible side effects from getting a vaccine. It's not always that the vaccine caused the adverse event, and really that's the job of the CDC to make that determination. So the other link that we have is, if you are interested, you can go to get the VAERS data. You can also see some information on how to interpret the VAERS data, and I have some bullet points on these slides. So some of the strengths of VAERS is that, like I said, anyone can access the reports, and so really it's geared to getting as much information as possible to detect rare adverse events. VAERS collects information about any vaccine, the person vaccinated, and the adverse event. And like I said, the researchers follow up to get additional information in those situations. And all this data is publicly available. The limitations with VAERS is that it's considered a passive reporting system. So in situations where someone has a very mild reaction to the vaccine and they don't feel like they need to report that information, VAERS is not going to collect that type of information. It requires either the patient or the provider to voluntarily provide the information on the adverse event. Sometimes the VAERS reports are submitted by people who don't fill in all of the information, or they contain errors. And so it's up to those researchers at CDC to kind of fill in the gaps in terms of those VAERS records and make sure that they have complete records before doing any kind of analysis on this information. The other point that I kind of already mentioned is that VAERS data alone cannot determine if the vaccine caused the reported adverse event. Like I said, this is intended to collect as much information as possible. The VAERS data alone is not intended to allow us to draw causation or causality between a vaccine and an adverse event. The number of reports submitted to VAERS may increase in response to kind of public awareness or media attention. So as I said, a patient can go in and submit a VAERS report, a provider can go in and submit a VAERS report. And so this is kind of a double-edged sword. As more people are aware of this system, you can go in and submit information. As I was going through VAERS information related to reports that have been submitted among those Wisconsin residents, there were certain instances where it appeared that there was maybe some problematic entries with the amount of information that was provided, and inconsistencies in kind of the patient information for some of these VAERS records, and the text describing those patients didn't really align. In some cases, there were the patient information in VAERS was recorded as like an elderly female patient, and then the text describing the adverse reaction referred to the patient as a middle-aged male adult. So certain situations, there's just, there's the system is not set up to detect those errors. And like I said, it takes some additional information to make sure that those records are entered properly and correctly, and the CDC and the researchers within the CDC are making those determinations. And then finally, it is not possible to use VAERS data to calculate how often an adverse event occurs in the population. So again, it's not really a reliable data source for us to use to really understand how adverse events are occurring in the population. And that's why we're going to be reporting out on the number of adverse events that are occurring among Rock County residents, so that we do have that information and we have a little bit better context for how safe and effective the vaccine is for our residents. The other pieces of information that are available related to vaccine safety and effectiveness is there's a program called Vaccine Safety Data Link. And this is a system, Marshfield Clinic in northern Wisconsin is part of this group, but it's a group of health systems that are part of a research project to connect electronic health data with adverse reactions reported after vaccines are administered. So really the idea is to connect any type of information in a patient's electronic health record to an adverse reaction to a vaccine, to have better information and data to determine if their adverse reactions or responses were due to the vaccine or some other type of cause. The other piece of information and system that exists right now to track vaccine safety is called the vSafe system. And some of you may have used this when you received your vaccine. Essentially, it's an app that you download after you are vaccinated, and it will ping you and send you notifications and reminders to track whether or not you're experiencing any kinds of symptoms after you receive that vaccine for COVID-19. The idea being that people can report immediate types of reactions, and also the system is set up to remind you to respond to these questionnaires a few months down the road, so we can see if there are more kind of prolonged symptoms or side effects that people are experiencing with respect to their COVID-19 vaccine. So I know that was a lot of information to cover in a small amount of time, and we got through it all. That's the information that I wanted to share today in terms of vaccine safety. Again, we'll send out kind of a more formal communication in terms of when our official report is up on our website with respect to the Rock County data related to adverse reactions to the COVID-19 vaccine. And as always, you can submit your questions to us via Facebook or via email if you have those. I'm just going to check the chat box here to see if there have been any questions that have come in. Do you have a ratio of vaccinated to unvaccinated in the confirmed cases? So in terms of our breakthrough cases, the question is, do we have a ratio of vaccinated to unvaccinated in confirmed cases? That's another piece of data that I'm working on currently. So I can report for the video today, we have about 800 instances of breakthrough cases among people who are fully vaccinated. When we compare those rates compared to the number of cases that have occurred among people who are not vaccinated at all, the ratio is much, much lower. So there's a much higher risk of infection among those who are unvaccinated. And this ratio, the difference in the ratio increases pretty drastically as we're looking at those who are severely ill. So the vaccine is highly effective at preventing severe illness and death. And so when we look at the difference in the ratio, there's a very small number of people who are fully vaccinated who need to be hospitalized versus those who are completely unvaccinated. And same with the deaths. There have been a handful of deaths among people who are fully vaccinated, but the risk is much, much greater among those who are completely unvaccinated. So I appreciate the question, and I think there's been a lot of interest in those differences. So we're going to try to put together some kind of graphic that's similar to what the state of Wisconsin has to show the difference in rate of cases, hospitalizations, and deaths based on those who are fully vaccinated, comparing those to the individuals who are unvaccinated. All right, and then I'm just checking the chat box to see if there are any additional questions here. All right, no more questions. So with that, we will conclude the stream. I thank you all for joining us today. And if you have questions upon watching the recording, you're always more than welcome to send us questions, and we'll add those to a future stream. So with that, we'll sign off, and I'll see you all in a couple weeks. Thank you, everyone.